Hello and good morning. My name is Venkat Lellapalli. The topic for today is healthcare data analysis using machine learning algorithms. So that's my presentation for today. Before we start, a quick introduction about me. My name is Venkat Lellapalli. I am a part-time PhD student in Mississippi State University in the Department of Industrial and Systems Engineering. And I work full-time in a healthcare company working on healthcare data. That's data related to healthcare claims, provider information, and a lot of that interesting data. And I make predictions based on that healthcare data. So that's basically my full-time job. And as I mentioned, the presentation for today is healthcare data analysis using machine learning algorithms. So for the agenda for today's presentation, so a quick introduction followed by a theoretical framework of the research and the methodology that I'll be using for my research, as well as the literature review. In my research paper, I have about 50 odd literature review from journals. And I'm not going to present all of them here, but only the salient machine learning related literature review. I selected a few of them for this presentation. And data analysis, because it's important that for such type of research work, we have accurate data, the correct data, and the repository and the source of the data is reliable and can be quantified. So it's important that we have the right repository and quantifiable data. That'll be followed by a conclusion and the future work that I plan to do on this research work. So quickly moving to the theoretical framework, hospital readmissions. So what exactly constitutes a readmission? A readmission event generally occurs when the patient has been discharged and has been readmitted to the hospital within a certain period of time. That certain period of time can be 30 days, 60 days, or 90 days. So a diagnosis and a procedure has been performed on the patient, he's been discharged, and again has been readmitted. Generally, we do not want to have that type of issues. And we want to have the service completed at the first point of interaction itself. And also these hospital readmissions are basically indicator of the quality of services that are offered by hospitals. So more the patients are readmitted after a diagnosis and a procedure has been performed. That looks poorly on the hospital and the facility. Provider facilities. So for this particular research, I'm looking at cardiovascular diseases because these are important and leading cause of death globally. And in 2016, they had accounted for approximately 17 million deaths. So that was about 31% of all global deaths. And the tools, is important that if you have data, you use the right tools. So for my research, I'm using the machine learning algorithms. We are fortunate to have a lot of research and work done with machine learning and AI. So we have several of the tools available to us for our data analysis. And as I mentioned, the literature survey, we'll be looking at two of the cardiovascular diseases. The first one is the pulmonary hypertension or the pulmonary artery diseases, PAD. And I'm also looking at all forms of ischemic heart diseases for my research. So let's now to the methodology. As I mentioned earlier, having the right data is good. But from where do we get the data? It's important that the data is accurate, correct, reliable. So for my research, I am looking at the National Readmissions Database. This is US database that is reliable, and it's a family of databases on software tools that was developed by the HCUP project. That's the Healthcare Cost and Utilization Project. Uh, for this, I looked at the latest data. The latest data that's available on this database is from the year 2016. And just, I think, sometime March of this year, they loaded the data for 2017. So I'll be looking at 2016 as well as the data from 2017. And this NRD database, or is called the National Readmissions Database, includes discharges for patients with or without repeated hospital visits. And also those who have unfortunately passed away in the hospital during the procedures. So that's the type of data that's available on the NRD database. And having the data and the tools, it's also important that we use the right software to do the analysis. And for my particular research, I'm looking at R as a software tool for statistical analysis. The reason being that R has embedded machine learning algorithms and is easy to interface with any new algorithms that are available to look at the data and make predictions. So for my analysis, I'm basically looking at unsupervised learning as well as supervised learning methodologies. And now the literature review. As I mentioned, there are about 50 odd papers that are available in my research paper, but I don't intend to showcase all of that here. So what I've done is I have segregated and categorized those papers into supervised principal component analytics, or it's called supervised PCA, and tensor-based machine learning, as well as logistical regression and random forest type of methodologies. For supervised PCA, one of the papers that is of importance and is highlighted is the paper by Davis. He had investigated the mechanism of failure of right ventricle and survival of patients with pulmonary heart diseases. And he had predicted using supervised 3D pattern machine on patients that were diagnosed with the pulmonary diseases. This is an interesting paper, and I looked at it extensively, and I find it very interesting for my research. And the next is the tensor-based machine learning. Swift and others have developed a tensor-based machine learning for pulmonary heart diseases using the CMR technique, or the cardiovascular magnetic resonance technique. And the output of this research was that they come up with a high diagnostic accuracy. The area under the curve was 0.92, and the P number was 0.001. So that's pretty good numbers for a tensor-based machine learning technique. And the third is the logistic regression and random forest. Lee Ha compared prediction accuracy in pulmonary hypertension between algorithms based on machine learning. And this is also another interesting paper because they looked at classification trees, boosted classification trees, random forest, and SVM. This paper I found to be very interesting and had a lot of exhaustive information on how that research work can be effectively utilized in my research. Literature review for SVMs. I looked at basically Gumbri and Morgan. These are the two famous research papers whenever we mention anything related to machine learning and related to healthcare. These are the two papers that pop up in front of us as highly important and reliable papers. And also looked at naive-based algorithms. For example, it was Min and Shamir. Shamir, for example, he developed a electronic medical record model based on data-driven machine learning to predict 30-day hospital readmission rates. And I think he used about data from 1,068 patients with heart failure. And the area under the curve was 0.78. So that's again a pretty good number. So those are some of the highlights of my literature papers. And besides those that I have shown in my previous slides, there are others that are effectively good and excellent. For example, there's linear discretion analysis based in classifier, the feature selection, and the CART, SVM. These are all good machine learning techniques that have been used to predict heart conditions and patients being discharged and readmitted. So I just highlighted those techniques rather than those papers, but the details on those papers for this techniques are available on my research paper. And quickly coming to the data analysis, why is it important? Because we have to have the reliable data, as I mentioned. And HCUP is a repository from where I have received the data. And this data comes in 3 compressed files. One is the core file. This is the NRD 2016 data that has information on the patients, as well as the diagnosis code and the procedure codes and admission dates and all the salient features that are needed for good research. And the second one is the hospital file. This is a file that has information on the hospitals across the US that had these patients admitted. And the severity measures file. This is another file that comes in with severity indicators for this diagnosis and procedure codes. So these are the 3 types of files that I had to look at. And as I mentioned, for these 3 files, the number of observations were about 17 million records, and as you can see, that's a big data of work. And the total number of data elements was about 103, and as I mentioned, I'm looking at the ischemic heart diseases and diseases of pulmonary circulation. Those are the diagnosis code 120 to 128. These are 2 types of CVDs that I plan to use for my research, and 17 million records is a good source of data, I would say, this is reliable data again. So now the conclusion, quickly going through the conclusion. From the research papers that I looked at, I see that there's a lot of work that has been done, but there's very less research that's been done on the 2 types of diagnosis codes that I picked for my research. There's hardly, I think, any research that has been done on those diagnosis codes. So that's a good starting point for me to look at that type of research. As I mentioned, since there's a paucity in research on the ischemic and pulmonary heart diseases, making predictive model development on this type of heart failure and coronary artery diseases is important for cost savings. And for future work, as I mentioned, I have already looked at data for 2016, and I'll be looking at data for 2017, comparing both of the data and then coming up with machine learning algorithms to make effective predictions based on the 2 diagnosis codes. So that's basically the research work and my presentation. These are some of the references that I have shown in my presentation. This is just a quick snapshot, not really a complete exhaustive list. So that concludes my presentation, and if you have any questions, you can definitely reach out to me. I have my email ID in this presentation, so you can reach out to me for any discussion or any clarifications on this presentation. And thank you everyone, and have a great day and a great conference. Bye.